Did you know that uncontrolled diabetes or poorly managed diabetes can lead to serious health problems like blindness, kidney failure, heart disease, stroke, erectile dysfunction, limb amputations, and even premature death? Now, let me also add that for people living with diabetes, taking their medications only, taking their drugs only is not enough in the management of diabetes. Why? Because it requires a multidisciplinary approach in management. So it requires the input of the doctor and medication, it requires the dietitian's involvement, it requires even physiotherapy, sometimes eye doctor, and many other aspects to be able to manage diabetes. I welcome you today to Diet Talk with Dietitian Michelle, your food expert. And as you already know, this is a diet program. We talk about food and how food affects our health. I am Michelle Umadi. You can also call me Dietitian Michelle. So today, what do I have for you on Diet Talk? It's our case study day. This episode, I dedicate it to sharing case studies, practical case studies, so you get to understand the role that diet plays in the management of diet-related diseases. And for today, we are dedicating it to diabetes. I will share one case study, one of our clients that we have helped in achieving good control. But before I share this case study with you, let me tell you what inspired Dietitian Michelle to obtain a certificate in diabetes care from the University of Warwick, London. Are you ready? Let me share this story. Now, while I was in Juice, when I was working there, we usually have diet plans for people living with diabetes. So we give them the diet plan and say, yes, follow these foods. They are healthy. Their foods are moderate in carbohydrate, low glycemic index, and full of legumes. You know what we call legumes? Foods you get from beans, moi moi, akara. These are all legumes. So the diet plan is quite rich in that. So I saw a patient with diabetes, a lady, and after consulting, I gave her the diabetes diet plan and she went home. Do you know what? She came back after 2 weeks for her follow-up to see the doctor. Then she also came back to see the dietitians after follow-up, and she came back sad. She was so sad, she was devastated. I mean, she had done everything she was told to do. She was taking her prescription, she was following the diet plan we gave her, but her sugar level was just not going down. It wasn't getting to the normal level, and so she was sad. In fact, I remember her words saying, "My pikin, I don't do everything. I have done everything I was told to do. In fact, I don't chop beans, saute. My body now reacts to beans whenever I eat it." I mean, I felt so sad for her. Not only did I feel sad for this woman, I was also disappointed in myself as a dietitian. Why could I not play my own part well? Why couldn't I help this woman with diabetes? At that point, I knew that something was wrong. I knew something was missing in our management, and I had to get it right. So I committed to finding the missing link and fixing it in the management of diabetes. So I went searching and I researched everywhere, checked the internet, checked what is obtainable outside Nigeria, in other countries, the UK, everywhere. In fact, I searched and searched until I discovered that yes, there is actually a step forward. Apart from giving people living with diabetes a diet plan to serve as a guide, there is something else that they require, and I had to learn that. And that is why I had to enroll for the course called Certificate in Diabetes Care. That course opened my eyes a lot to what should be provided for people living with diabetes. Yes, after I enrolled for the course, I realized that in managing diabetes, there is no one size fits all. We cannot just give you diet plan and then give Mr. A the same diet plan, give Mr. B the same diet plan. It was after this course I realized that that is not the way forward. Yes, the diet plan is supposed to serve as a guide for those people who are just newly diagnosed, to say, okay, these are the kinds of foods that you should be eating. But there is something much more than that diet plan and guideline. You need to get what we call individualized, personalized, customized diet plan. You need to work with your dietitian depending on your drugs, depending on your age, your activity level, many other factors. The diet now needs to be planned because there is no one size fits all. That is just the summary, and that is what I pitched from that course. Now, today, when I meet with cases of diabetes, it's no longer a heartbreak. I am no longer afraid. I have proven records in the management of diabetes, especially when it is combined with medications. and other aspects of the management of diabetes. Yes, so in summary, what I'm saying is that in the management of diabetes, there is no one size fits all, especially when it has to do with diet. Just the way the doctor will make prescription based on the uniqueness of the condition, that is also how dietitians will need to plan the diet depending on the case. In fact, let me even give you an instance. For somebody who is on insulin, the diet therapy for that person will require it to be matched with the amount of carbohydrate that the person is taking. So with the amount of insulin the person is taking, so let's assume that the person is on 15 units of insulin in the morning, soluble insulin. You will have to match that with the carbohydrate. You have to calculate the amount of carbohydrate the person needs to take. Because if the carbohydrate is not enough, even with the insulin, the sugar level can be high, the sugar level can be low. So if the person is taking 15 units of insulin and the person ends up eating carbohydrates as high as 200 grams, regardless of the insulin, let me tell you, it will still not be managed. So can you see why management of diabetes is multidisciplinary? You will require the input of dietitians. Let me also tell you about those who are on sulfonylurea medications. For those people, their diet needs to be up to 4 or 5 meals in a day. Why? Because they are at risk of having low sugar level. So if you don't put that into perspective, you'll be wondering, why am I taking my drugs and it's not working? Why am I taking my drugs and I feel dizzy? Why am I taking these drugs and the sugar is not going down? Why am I taking my diabetes drugs and I'm not getting better? You need to factor in all other aspects in the management of diabetes. I hope we are clear on that. Yes, so in managing diabetes is a multidisciplinary approach. It requires the input of the doctors, it requires the dietitians, it requires physiotherapy, there is exercise, part of it, to tell you when to exercise, how to check your sugar level. It requires education. In fact, I think there's something called MEDEM, MEDEM, that tells you the things that you need to put in place in the management of diabetes. We're talking about practical case study in the management of diabetes, dietary management of diabetes, please, diet management of diabetes. That is my focus for today. I just shared a story on what inspired me to pursue a course, a certificate in diabetes care, to be able to understand clearly how to help people living with diabetes. In fact, I even discovered that in many countries, you would have to be a certified diabetes educator for you to be able to manage a diabetic case because of how sensitive it is. It can be confusing sometimes, let me tell you. So it's important that they are sure you know how complicated diabetes management can be and you are equipped with the right information. So you have to undergo the training, then get certified before you are even allowed to manage a diabetes case. For us here in Nigeria, God help us, we'll put in our best. That is just it. We'll put in our best to ensure that we are able to help you. So sharing with you one case study on how we helped these clients. I got a referral to consult this a retiree of one of the oil companies in Nigeria when I was in Port Harcourt. So during his assessment, during his nutritional assessment, while we were talking and I was getting his food history, knowing what he eats and all of that, I discovered that this man seems very knowledgeable about diet in the management of diabetes. I mean, he was clear on foods that were high in glycemic index and foods that are moderate in glycemic index and how he chooses. So I was wondering, I was now asking myself, so what is wrong? Why is he not achieving the results that we are looking for? Why did the doctor still call us in? Because it looks like he has seen a dietitian before. It looks like he has a diet that he's following. So what exactly is the problem? But we continued, and after the assessment, we planned the diet. I remember placing him on 1,800 calories with moderate amount of carbohydrates, good protein, and moderate fat. This man we're talking about, as of then, he was 78 years old, so well advanced in age. And you know, these people will go to school, like he speaks well and very, very enlightened. So he knew so much about diet. But do you know what? He subscribed for our Citadel plan that included monitoring. And that monitoring is what helped us to help him. We didn't stop at the assessment. We didn't even stop after planning the diet and giving him the diet plan. So, okay, this is a diet plan that will help you based on your history, based on your medications, based on your history, based on your food, based on your activity level. This is a diet plan that will work for you. No. we continue to the next stage in our management, which is monitoring. And this is what we discovered. He is required to send us his reports every day, send us a report of his meal intake, his activity level, then his sugar readings in the mornings. Then this is what we found out. Whenever he eats his dinner past 5 p.m., his sugar level goes up. No matter what, in fact, even if it's cabbage or cucumber or beans, whatever thing you give him, no matter how healthy that food is, if he takes that food past 5 p.m., his sugar level will be up. So we monitored the trend during that period, and we said, sir, this is what we are seeing. This is what we are noticing. Whenever you eat your dinner late by 6, 7 p.m., your sugar goes up. But when you eat by 5 and you say, oh, I feel so full, I don't think I would like to eat my dinner, your sugar level will be normal. So we had to focus on that. We worked on his diet plan again, placed him on the right amount of calories and carbohydrates. Now made it to be that his dinner is going to be taking place by 4:30 p.m., latest 5 p.m. Lo and behold, that was just the solution he was looking for. So can you see that it's just beyond counseling? Dr. Michelle, tell me what to eat so that my sugar level will be normal. Dr. Michelle, what are the foods that are good for people living with diabetes? Dr. Michelle, what are the foods that I should eat? What are the foods that I should not eat? So can you see that it's beyond that? Medical nutrition therapy, which is the service that dietitians provide, involves 5 stages, and all 5 are important. First is the consultation that would happen, which is mainly the nutritional assessment for us to know your health status. Then second, we'll now plan the diet. After planning the diet, after making the nutritional assessment, then planning the diet, then monitoring. That monitoring is important, and that is when a lot of us are getting it all wrong, because you just give the person the diet plan and you're on your own. Whatever happens, we don't know. But that monitoring ensures that your body is responding well to the diet that has been planned, to be able to notice anomalies and correct them. Then even after the monitoring, we have feedback. Feedback is where we communicate back to the doctor that referred to say, this client you have referred, this is what we have done. This is how we have helped him. Do you have any input? Do you have questions to ask? Are there things you are not clear about, so that we can now work with you? So this is how we're able to help this client achieve control. Monitoring is what helped him, not just the diet that we planned. So I hope you are clear and you're convinced that in managing diabetes is a multidisciplinary action, multidisciplinary approach. It requires the input and the involvement of other health professionals in order to achieve control. I would like to emphasize again that in the management of diabetes, it requires a multidisciplinary approach, requires the involvement of just the doctor in prescribing the right medications. You need to get your diet right if you must achieve control. This is evidence-based practice. It's proven. You can search it, you can check anywhere. You can check with health organizations, WHO. Just type it there. What do I require in the management of diabetes? And you're going to get it all clear. Diet plays a key role in managing diabetes. And just like the case study that I shared now about one of our clients that we helped in achieving control, the major problem he was having was not even the food he was eating, but his meal timing. His body was trying to communicate, was sending a message to him. But because he's not a dietitian, he couldn't make sense out of it until we came on board and we discovered what the body was telling him. That is not just enough for you to count the carbohydrates you're taking in, but we also want you to stop eating by this time. Possibly because of his age, his body didn't want too much food and couldn't handle it past 5 p.m. So for diabetes, they say knowledge is power, but I've come to realize that in managing diabetes, knowledge is not just power. Knowledge is now freedom for them. Knowledge is freedom from fears, freedom from worries, freedom from uncertainties. What will I eat so that my sugar level will not go up? What will I eat so that I can maintain my sugar level? What will I eat so that this will happen? Do you understand? So for them, it is freedom from fear when they are clear on what they should eat. They are clear on how much to eat and clear on when to eat. They become happy and they live freely without fear, without anxieties. Now I'd like you to join the conversation. If you have diabetes or if you have a family member with diabetes, share with me one of the struggles or challenges you may have been having with diet. Let's see if we can rub minds together. But always remember that in managing diabetes, it is an individualized approach. You cannot just share diet plan. Some people will say, oh, I've seen the dietitian now. There is no need for you to see the dietitian. This is a diet plan I was given. You can follow it. You may have good intentions, but I tell you, you'll be causing more harm than good, because your case is different from that friend of yours that you want to help with your diet plan. Encourage them to see dietitians and get their own personalized, individualized diet plan for management. Now you can join the conversation. Let's talk. This is the number you can call: 0707 070 8210. 0707 070 8210. You can also send a message to the WhatsApp line so that we can talk: 0813 701 0749. That is a WhatsApp line that you can send a message to. In fact, I also have something to share with you. After I left Jos and I went to Port Harcourt, one of the hospitals reached out to me to say, Dietitian Michelle, please give us diet plans for people living with diabetes. Give us diet plan. Let's give people living with diabetes. Remembering my experience, my past experience, it didn't go quite well with me, and I didn't like that. So I said, why don't you allow us consult instead of giving you diet plan? Now, which diet plan will I give you? Is it diet plan for male diabetics or for female diabetics? Or is it diet plan for young diabetics or old diabetics? Will it be diet plan for people on insulin or those on metformin-based drugs or sulfonylurea? Which diet plan am I going to give to you now? Do you understand? Because it's individualized. I can't give you one diet plan. So how do you want me to come in? Let's consult and plan this diet for them. And she said, no, we don't want to do that. We are worried or bothered that when we give out these clients' contacts, we may end up losing them. They may end up in other hospitals and will begin to lose revenue. Well, her fears and worries may be justified, but that's what makes us all different. Personally, I will not give up quality care for a client because of my own gain. Yes, that is just it, because when the client is happy, satisfied, and healthy, I am happier. So this is to convince you that diet therapy is key, is important in the management of diabetes. All right, so you need to work with dietitians to work out a plan that suits you the most. Now, on how we can help you at CNC, Standard Nutrition Consult is a nutrition clinic with many dietitians available to offer consultations, plan your diet, even culinary service to help you achieve control. So ways we can help you: you can schedule a consultation with a dietitian for yourself or even a loved one. Someone called last week. She wants to consult dietitians, but not just for herself. She wants to pay for herself. She wants to pay for her mom. Now, that is how to show true love. It's not enough to buy wrappers and buy them bread. If they have a condition that is diet related, you should try to book appointments for them to see dietitians and help them with their diet. So if that is you, you can send consultation to any of our official number. Yes, we have 0708 987 3497 or 0904 675 8079. Just send consultation and someone will attend to you. Book your appointment to see a dietitian. I know that you are busy. For some of you, you're very busy. You go to work from Mondays to Fridays, then on Saturdays, wedding, parties, shopping, cooking, and all of that. So many things to take your time. We understand, which is why we also provide virtual consultation. You can stay at home. Stay at home and still get expert advice from dietitians. All you need to do is to call us or visit our website www.citadelnutritionconsult.com, and you can book an appointment there to speak with CNC dietitians. Or you can just text virtual consultation or distant consultation to any of these numbers: 0708 987 3497 or 0904 675 8079. Then we also have online courses. You just want to understand diabetes, dietary management of diabetes first. You may not even be diabetic. Maybe it's a loved one, maybe it's a neighbor, maybe it's a friend, maybe it's someone you care about, and you want to understand the dietary management. What is it that he said? What is it that I need to know in the management of diabetes? If that is also your own case, then we have online courses on our website, www.dietitianmichelle.com. You're going to see online courses there on diabetes, on obesity, on cancer. Just subscribe, listen, learn, and you can help someone. We are also open for partnership. If you own a hospital or you direct a hospital, a health insurance company, a gym, or even a hotel, we'd love to partner with you to offer our nutritional services. Let's partner. Let's put the patient's health first. Let's put their health first and not just our own interest. Let's partner with you to provide that. Especially if you cannot afford to employ a dietitian, then partner with us. We will provide the service. We would help your clients, we will help your patients achieve good control in the management of diabetes and other diet-related diseases. Just send partnership to our number 0904 675 8079. Yes, send partnership to this 0904 675 8079, or you can fill out our form on the website www.citadelnutritionconsult.com. Fill out our form on partnership and we will reach out to you on how we can work together. Thank you for joining me today on Diet Talk with Dietitian Michelle. I hope you had a great time and you have learned something, especially concerning management of diabetes. I encourage you to contact us today. Let's work together to create a customized diet plan that suits your lifestyle and goals. I assure you that with Dietitian Michelle and other members of CNC company, we know how to help you achieve results. And don't forget to follow me on social media. There are many things you're going to be learning when you follow me there on Facebook, on Instagram, on TikTok, on LinkedIn too. You can check me out there to know what I've got. So on Facebook, you'll find me as Dietitian Michelle, on Instagram, Dietitian Michelle, on TikTok, Dietitian Michelle, Twitter, Dietitian Michi, and on LinkedIn, Michelle Omadi. Now, this is the main place where you're going to get a lot of content on nutrition. Check me out on YouTube. You'll find me there as Dietitian Michelle. You'll find so many interesting topics, things that would help you make right food choices, things that will help clarify problems or challenges you're having, questions you're looking for who to ask. You might find them there. So just look for me on YouTube, Dietitian Michelle. I also told you to check something that I posted there on non-stick pots, if we should cook with non-stick pots or not. I don't know how many of you have, but I know that last week Radio Mama told me that she has checked and she is informed on what to do with non-stick pots. Now I encourage you all, go to YouTube, Dietitian Michelle. You're going to find interesting topics there, even on sugar. Do you know what sugar is? Do you know whether honey is better than sugar? Do you want to know if you should take honey or take sugar, or if you take date syrups? Are you confused? You will find useful content there. Just go to Dietitian Michelle page on YouTube for more information. Thank you very much. Next week I'll be back on Diet Talk with Dietitian Michelle. And do you know what we are going to talk about? I have a video that I'm going to share on my social media handle, and I'll be responding to that video. Just yesterday evening, my dad sent me the video. A man that is telling people the kinds of fruits to eat and fruits not to eat based on glycemic index. I doubt if he even knows what glycemic index is and how to use it in managing diseases. But here, he has published a video that will be confusing to many people living with diabetes. In that video, he listed out almost all the fruits that we have and said people living with diabetes shouldn't take them. People living with diabetes shouldn't take orange. They shouldn't take watermelon. I know it's going to be confusing. And since my dad has sent me that video, I bet that 2, 3, 4, 5 persons will still send me the video. So I have decided that I'll come back next week to respond to the video so that I'll be ready. As you're sending me the video, I am sending you my response so you understand glycemic index and how to make your choice when it has to do with food and fruits. In fact, he listed out they shouldn't take orange, they shouldn't take watermelon. So what are they going to be taking? Only sour soup. Why would you say people living with diabetes should take just sour soup because it has a low glycemic index? It's just a clear indication that he doesn't even know glycemic index. He doesn't even know things that can influence or reduce or increase glycemic index in foods. So I will respond to that. I hope you're not planning to miss next week's episode. Tell a friend to tell a friend to tell another friend to join that next week episode. You will be clear on glycemic index and how to use that to choose or decide on what to eat if you're living with diabetes. Thank you very much once again. I enjoyed today's episode and I look forward to seeing you again next week. Bye-bye and God bless you.